As we well know, hormone receptor positive, HER2 negative early breast cancer are generally described as being immunologically cold. However, we have recently seen that the addition of immunotherapy to chemotherapy in this setting has been reported to increase PCR rates. So it's very important to identify if there are some groups of patients which might be the ideal candidates for this kind of association. In this study, we assessed gene expression data from two multicentric neoadjuvant phase 2 trials, the JADA and the LETLAB trial, which enrolled stage 3A hormone receptor positive HER2 negative breast cancer. And in the same trials, we had gene expression data from baseline tumor tissue, and we also had TILS evaluation according to guidelines on this same tissue. And what we observed in these studies is that quite consistent subgroup of hormone receptor positive HER2 negative breast cancer patients. In these studies, we have to consider that almost around 50% of patients, so one half of the patients had grade 3 tumors, so they had a quite aggressive biology, and around almost 25% of patients, almost one quarter of patients had a basal-like or HER2-enriched tumors according to PAM50 subtyping, so according to gene expression subtyping. And what is interesting is that basal-like hormone receptor-positive HER2-negative breast cancer actually showed higher levels of TILs at baseline, and they also showed higher levels of different immune signatures. So we assessed immune signatures associated with CD8 T cells, cytotoxic T cells, interferon gamma, and also a signature which was associated to response to immunotherapy in the GEPER-Nuevo trial. And also the basal-like tumors, even within this subgroup of hormone receptor-positive HER2-negative breast cancer, had higher level of PD-1, PD-L1, and PD-L2. And what is very interesting is that, in fact, when we assessed the association between the basal-like PAM50 signature and TILs or immune signature, these were, in fact, correlated, but they were only moderately so. So we are probably assessing different biological features, which are in part assessed, but we might suppose that these patients with hormone receptor positive HER2 negative breast cancer, which simultaneously show features of biological aggressiveness, such as non-luminal subtypes and enhanced immunogenicity, such as higher TILs or higher immune signature, might represent the ideal candidates for the combination of immunotherapy and chemotherapy in the neoadjuvant setting.